بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أنا الدكتور محمد عادل الحديدي، أستاذ الطب النفسي وعلاج الإدمان بكلية طب جامعة المنصورة. Today I am Dr. Mohamed Adel, Professor of Psychiatry, Mansoura University. Today we will discuss a very important topic about the health belief model and theory of reason to action. This is my contact data for any information on for contact. The learning objective for our lecture today will be what is the health belief model? Health belief model, the core assumption and statement. The health belief model including 6 constructor. What are these? What is the theory of reason to action? The limitation of theory of reason to action and application of theory of planned behavior. Case scenario. This is a normal case scenario you usually face in your clinic and in your day working, and this is to explain why we will study this theory of reason to action and health belief model. In this case scenario, we have 45 years old male patient named MA came to emergency hospital complain from acute stabbing chest pain in the chest referred to left shoulder. The patient is 170 centimeter tall, 145 kilogram weight. It's too weight to so many is so he is very obese. He smokes about 4 packages of cigarette per day, and which is very much. Echocardiography and ECG confirm cardiac infarction. You advise the patient to stop smoking and decrease body weight. And these 2 objectives are very important to help this patient to control his condition and to prevent recurrence of this condition, which is very fatal. The question is, to what limit you will expect it that the patient will comply to your advice? To what limit? How you can expect, does the patient will comply to your advice or no? Because we are as a doctor sometimes or many times giving advice to the patient and asking him to comply for these questions or to this advice. But many of patients comply, but also many of patients don't comply for what you are advised. That is why we have these 2 theory. We have this theory that we will study here. First theory is health belief model and theory of reasoned action. The health belief model is a psychological model that attempts to explain and to predict the health related behavior, like using condoms, stop smoking, practice exercise. All these are very important issues to be used to keep person healthy. Health belief model was developed in 1950s by social psychologists, and they do this work for the core assumption and statement for this health belief model was a person will take the health related behavior action if the person feels that negative health condition like HIV can be avoided, if the person feels that positive expectations that will be taken by doing the recommended action, he and she will avoid a negative health condition, avoid legal sexual interaction or legal sexual relation, and using condom if the partner is is ill and will be effective in preventing HIV. So, if the person feel that the condition is serious, he may be taking this action. Also, if the person believes that he or she can successful taking this recommended health action, because there is many barriers that usually prevent the person to do this action. For example, he or she can use condom comfortably and with confidence, and he will not impaired my sexual performance. Other say he don't feel happy to use condom during sexual intercourse, and so he refused to use this. To do the health or to study the health belief model, including the six constructor considered in this table. We have the concept, definition, and application. First of these concepts, what is called perceived susceptibility. Perceived susceptibility means that one's opinion of the chance of getting the condition is the condition is common to be get or the condition is rare. For example, if you are in Egypt and feel that the disease is spread in China, not in Egypt, so you feel that I am not susceptible for doing this, and so you are not taking the health construction or health advice. Also, if the condition, for example, is our disease, for example, is transmitted like by blood transmission, and you don't use any procedure including the blood or don't have any contact with blood, so usually you feel that you don't need the precautions or prerequisites to prevent this illness because you don't use any procedure, so you are not susceptible. So perceived susceptibility is an important one that provide you is I am in risk or I am not in risk. Another part is perceived severity. Does this condition is so severe, so I have to take precaution for this or not? For example, if we have person is facing condition like what we have now, corona, and the coronavirus is giving disease which is leading to death, so the condition is so severe, so all of us have to take masks, to take healthy precautions using sterilizing hand, washing hand, and so on, because it is very severe. Otherwise, it is an condition which is like common flu. If person has common flu, and this common flu is a self-limiting condition, and usually it is not leading to death, and it is not dangerous, so many people is not taking any precaution to prevent the common flu. So usually people taking the precaution to prevent getting illness according to what they perceive about the condition. If the condition is so severe, they will take the prerequisite. If the condition is not severe, they will not take this prerequisite. The other objective or the third constructor of this theory is perceived benefit. Does if I do what if I do what is asked or what the doctor asked to me for doing this, does this will prevent me from getting infection? For example, in coronavirus, in our condition now, if I take the prerequisite by using mask and using sterilizing substance or sterilizing alcohol and doing something like this and keeping social distance, does this help me to avoid getting this coronavirus or no? If this barrier, if this a condition can do, so I will do. Okay, so I perceive the benefit. Does the condition or prerequisite doctor saying for me to do is actually benefit or can do or can work, so I will do this otherwise I not. So once believe in efficacy of the advising action to reduce the risk of seriousness. Perceived barrier. Perceived barrier is also an important condition because sometimes the part or the condition or what the advice that doctor ask you to do, the advice that doctor ask you to do, you don't love it. You don't love it. And you may be hating this. For example, many people hate to get the mask in front of their face, and this feeling is bad. And sometimes say it is not making me beauty for girl, for example. They say it is not making me beauty. Others say I cannot take good breathing or oxygen by mask, and so on. These are barriers. So to what limit this barrier is important for me. If some girl, it is for their the most important to be a beauty, sometimes even more than getting the risk of the condition. So sometimes they prefer not to wearing the mask and continue are going and walking without dressing any mask to keep their beauty and to and although they know they could get the infection. So, barriers is one's opinion about the psychological cause for using the advised action. Clue of action is strategy to activate readiness. Does I have this strategy that could provide me to activate readiness to do the action or not? Self efficacy, the confidence in one's ability to take the action. If the person has this confidence, he will take the action. If not, he will not taking the action. There is another theory which is called theory of reasoned action. Theory of reasoned action is another theory. It is also in 17th and 18th, and the aim of this theory is to predict the behavior intention across the prediction of attitude towards the behavior and subjective norms. It has also four main constructors. One of these is attitude towards the behavior, subjective norm, behavior intention, and lastly, the behavior. In attitude, it measures the level of behavior beliefs, perceived outcome beliefs, internal alignment, and compatibility. Normal beliefs or normative beliefs, it measures the level of the perceived social pressure, perception of attitude of opinion leaders, perception of accepted behavior, perceived importance of behavior consistency. Perceiving or perceived control, it measures the strength of perceived control, perceived internal ability to carry out the behavior, perceived external ability to carry out the behavior. All these are playing a role in intention, and intention is going to give the behavior action. What is the attitude? The attitude is the sum of beliefs about particular behavior weights by evaluation of these beliefs. You might have beliefs that exercise, for example, is a good for your health. Also, exercise make you look good. Exercise take much time, and exercise is uncomfortable. So we have two factors with exercise, two factors against exercise. Two factors with being good, being healthy, and two is against, which is taking much time as uncomfortable. So each beliefs are weighted according to the important issue for you. Does it more important for me time and comfortable, or what is or to being healthy or good shape? So if the person prefer to have feeling sedentary life, he may refuse doing exercise. If he prefers to look good and healthy, he may choose to do exercise. Subjective norms, it looks like the influence of people on social environment on his and his behavior or her behavior, intention, and beliefs of people weighted by the importance on one attributed to each their opinion with influence of behavior and intentions. For example, you may be having friends who prefer to do exercise and usually encourage you to do exercise. On the other hand, your spouse, for example, she prefers sedentary life and she refuses to do exercise anymore. So, how you choose a decision? Usually, you choose a decision according to how who is more important for you, your friend or your wife. If your friend is more important and you love him more much, you will choose to do exercise. Or if your spouse is more influencing about you, you usually choose to avoid exercise. Behavior intention is the function of both attitude and towards the behavior and subjective norm. Both together are combined together to give you behavior intention to do the action. This behavior intention is combination of the attitude towards the behavior and the effect of social effect, what is called subjective norm. Both together give the behavior intention for you. If the behavior intention is going to do the behavior, usually you will do the behavior. If not, you will not do the behavior. Theory of planned behavior is modifying of theory of reason to action, and it is composed of six constructors that collectively represent the person's actual control over the behavior. We have behavior belief, a person's judgment of probability that implementing a specific behavior will lead to certain outcome. Attitude towards the behavior, a person a favorable or unfavorable attitude toward giving a behavior. Normative behavior or normative beliefs, a person's judgment of probability that associated individual or group would support or criticize they what you are doing. So the effect of community around you, does they support or does they refuse? Subjective norm, a person perception of social pressure. Controlled beliefs, a person judgment of probabilities that a given or enabling or constructing factor will be present. Perceived behavior control, a person's sense of self efficacy as related to implementing a particular behavior. This is an application for the theory of reason to action. For example, if you are going to do have a surgery because you have some illness, we have two person, one person called person A, other person is person B. Person A, surgery will relieve your pain in your back, and attitude towards the behavior, he usually feels that I would love to be pain free. So his attitude, he loved to be pain free, and the subjective norm is confirmed of my friend and family think I should have to do the operation in my back. And my friend, or I want my friend and my family know that I have the courage to have the operation. So he want make to feel free, pain free, and their friend or his friend usually supporting him to do the operation, so the operation usually done. On the other hand, person B have the same illness, but he feel also the pain in his back, but his attitude towards the behavior, he feels that being pain free isn't really possible because everyone in his life have some degree of pain. So he feels that being pain free is very impossible and it is no problem to have pain. His wife also thinks that he have to take just few rest and to avoid risk of operation. His wife want him to have a rest and fear from any operation. He feel and he has a concept that my wife is usually right. So he usually considered the opinion in his wife in taking any decision in his life. So the surgery is not choosing according to his concept of no problem to continue with pain and according to the concept that his wife is usually right and she refused the operation so she chose to avoid a surgery. The limitation of theory of reasoned behavior or theory of planned behavior, there are several limitations which includes the following. It assumed the person acquires the opportunity and the resource to be successful in performing the desired behavior regardless of the intention. It does not account for other variable factors that play role into behavior intention and motivation, such as fear, threats, mood, and past experience. And in fact, all these factors may be an important factor for detecting or expecting the intention behavior. While it is does consider the normative influence, it still does not take into account the environmental and economic factors that influence the person's attention to perform the behaviors. Sometimes the person have good intention to do surgery like what we say before, but he don't have the money for this surgery, so economic factor may be important and tricking the person to change his desire. A limitation also of theory reasoned behavior or reasoned action. The model has some limitation including a significant risk in confounding between attitude and norm since attitude can often be reformed as norm and vice versa. The assumption that when someone form an intention to act, they will be free to act without limitation. It is not true. So, what is the limit? The freedom to act. In practice, constraints such as limited ability, limited time, environmental and organizing limitation, unconscious habit, or these limitation of theory of planned behavior. We have practical study for the application of theory of planned behavior. This study was examining the application of theory of planned behavior to dietary behavior with particularly focus on the role of perceived controlled and self-efficacy as a two component of perceived behavior control constructor in theory of planned behavior. The method, a total of 287 patient or member of general public completed a questionnaire. The study was done by questionnaire. One concerning for influence of theory of planned behavior variable on intentions behaviors for either eating 5 proportion of foods containing from fruits and fish and vegetable per day or eating a low fat diet, and the second concern for the actual eating behavior 1 month later. So the study is asking about your concept and the series and behavior construct and the another questionnaire for what you have already done in the last months. In addition, the individual component of perceived behavior control or perceived control and self-efficacy and the discernment of belief were examined. The result for each behavior, the theory planned behavior variable were found to be good predictor for intention. So it is a very good predictor for intention, although less good at predicting the behavior with efficacy of being constant, more predictive than perceived control. Sum up, theory of planned behavior put general rules and the more favorable attitude and subjective norm, and the greater the perceived control, the stronger should be the person's intention to perform the behavior in the question. Summary up or summary of the theory of planned behavior. The theory is uh, is aimed to predict the deliberative behavior because the behavior can deliberated and plan. Preferably, according to theory of planned behavior, human action is guided by three kind of consideration. First one is behavioral belief about the likely consequence of the behavior. Normative believes about the normative expectation of the other. Controlled believe about the presence of factors that may facilitate or impede the performance of the behavior. This is the questions at the last of the main lecture. I provide three questions for you. You can read by yourself and you can detect the correct answer. Second question. Last question. Again, lastly, this is the end of my presentation today. I hope you are understanding this series that can help you to predict to what limits that people or the patient for you will comply to your advice to prevent any hazard they may facing. I am very welcome to for your discussion and feedback, and we have 10 minutes for this. Many thanks, and this is my reference for the presentation. Thank you.